All right, everybody. It is so good to see you guys for our final collective impact virtual workshop series. We are so glad that you're here with us today. As you all know, since its inception, Building Strong Brains Tennessee has connected brain science and communication science to change the culture in Tennessee to be informed by ACEs, trauma, and resilience. This culture change has prompted many professionals, communities, and philanthropists to use the latest brain science to better prevent and mitigate ACEs, trauma, and toxic stress. So 4 years of our comprehensive, coordinated, and collective work from both the private and public sectors have positioned our state as a national leader in ACEs response. With your leadership and collaboration, we hope this series will support communities to build safe, stable, nurturing communities that better prevent ACEs and build resilience. We want to thank the Tennessee Department of Health for co-hosting this series with us and Camelot for allowing us to use their online platform. We remind everyone that you are on mute and will be unable to unmute yourself. If you have any questions, please post them in the chat box for the presenter's response throughout the presentation. This webinar is being recorded and will be uploaded to the Tennessee Commission on Children and Youth's YouTube page. All right, so if you're interested in receiving any notice of future Building Strong Brains webinar opportunities, you can email our team at tccy.info@tn.gov. All right, Melissa, Oomer, I know that we've introduced you several times at this point and you've said don't worry about it, so I'm going to let you take it away.
Thanks, Jen. And welcome, everyone. Jen, if you don't mind just putting it in presentation, thanks. And we'll get going on slide 2. So for those of you who don't know me, my name's Melissa Oomer. I've worked in social impact consulting for 13 years and spent a lot of that time helping communities collaborate better together. And it's been really wonderful sharing with all of you and learning from all of you over the past couple of months. Our final session today will focus on 2 main topics, equity and measurement. And so we'll start by talking a bit about equity, sharing some definitions, and then getting into community engagement. We'll take a short break so that you can all stretch after the first 45 minutes or so. We will do a breakout called TRIZ, which I encourage you to stick around and participate in if you have a chance. It's a really fun facilitation technique that you'll get to experiment with today and then hopefully take back to your various coalitions and organizations to use in different contexts. And then we'll wrap up by talking about measurement and evaluation for collective impact. And we'll have a little time to reflect and wrap up. I'll make sure I share my email in the chat as we wrap up in case you have any follow-up questions. If you have questions as we go, feel free to put those in the chat as I'm talking. I'll pause to try to respond to some of them at the end of each section. And for any that we don't get to today, I can make sure I follow up with Jen and others after today's session. So to get started, I wanted to talk about the imperative to focus on equity in collective impact. One of the biggest areas the social sector has really evolved in the last decade is explicitly naming and designing for equity, which I'm sure many of you have experienced in your own roles in organizations. I want to start by just sharing a few definitions of equity so that we're all coming from and starting from the same place as we get into this discussion. So first, just to define equity, two different definitions I want to share that both highlight justice and fairness. One is from PolicyLink, that equity is a just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. So I like that this one really focuses on what's the outcome? What's the desired end state of focusing on equity? It really gets at the why. And the second one is that equity is fairness and justice achieved through systemically assessing disparities in opportunities and outcomes and redressing disparities through targeted action. So it really gets at looking at that data. Where are there disparities so that those things can be worked on? And that's what we'll talk about in the TRIZ exercise in a moment. So on the next slide, I want to define how is equity different from equality. I'm sure many of you have seen this image before. In the first image, it's assumed that everyone will benefit from the same support. So all 3 children are put on the same box, regardless of their height. So that's equality. They're all being treated equally, given the same support, if you will, to see over this fence and watch the game. In the second image, individuals are given different supports to make it possible for them to see the game. They're being treated equitably. This really recognizes that not everyone needs the same types of things to get to the same result. If we go to the next slide, I really like this third version in which the fence is removed. This is really getting at the root cause, that we're saying we actually don't need any supports for individuals. We don't need to think about equity because the root cause of inequity was addressed. The fence is removed. That's the visual of our systemic barrier. And there's a new chain link fence put in place that everyone can see. And so there's no longer a need to do that. So in the next slide, I just wanted to pause and talk about, why is equity important for you all working on ACEs? And again, this is probably obvious for a lot of you, but I just wanted to state the obvious to kind of ground our discussions. That while ACEs are common, about 61% of adults across 25 states reported at least one ACE, there's many groups that are at greater risk than others and have experienced more risk and more ACEs than others. So here, the stat from the CDC is that women and several racial and ethnic minority groups were at greater risk for having experienced 4 or more types of ACEs. And it would be great to be able to look at the data from Tennessee to think about who are these individuals and where are they and what has their experience been? Because if you're trying to improve health outcomes and reduce the cost of ACEs to society, it really makes sense to focus on the group that's most disproportionately affected. When you think about if you're a numerical person, a quantitative person, you think about where things are the worst, where do you have the greatest room for improvement, and you focus there, you're going to improve the average for everyone, for the entire community. And there's also a concept we'll talk about a bit later called targeted universalism. And if you focus and design for these groups that have the worst outcomes today, there's going to be ripple effects into the other parts of the population. And it's really important to note that this type of work will not happen by accident. Solutions need to be designed with intention and in partnership with these populations to really have impact. So just a couple more definitions before we get into how this applies to collective impact more specifically. That it's not just about creating equity, but making sure that people feel that they belong. So thinking about diversity, which actually was a part of the field probably before equity became so prevalent, means that your organization or the setting in which you're kind of doing work or volunteering or things like that reflects the differences in the community, that the community is not a monolithic group. Sorry, Jen, you can go to the next slide. So for example, an example I like to share is that I'm on the board of a community health center in my community. And there's regulations that the board must have, I forget the percentage, but majority must be patients that receive care at the community health center. But what there aren't kind of regulations and requirements for is other areas of diversity. So making sure that the board reflects the patient population that it serves in terms of race, age, income, et cetera. And so it's really important that your leadership, whether it be board or your leadership team or your staff that is interacting with folks every day, really reflects the community because they understand the different challenges and opportunities that exist for the different diverse populations that you serve. And it's not just about representing the needs of those individuals, but also creating a sense of belonging. Belonging, the definition here is that people feel welcomed, valued, and a part of the decision-making process. And to get to belonging means you really need to share power. And that's what's really tough in the social sector in terms of figuring out ways to shift power. The power has been concentrated in the hands of certain types of individuals for decades, and thinking about how do we share power and decision-making with the individuals that we're trying to improve their lives. And so that's what a lot of folks are working on today. And so what does this mean in terms of collective impact? So in the next slide, we've talked a lot about the different elements of collective impact and the different structures and kind of ways to operationalize it. And you have to be really intentional every step of the way in the design and implementation of your collective impact work to embed equity. It's not just going to happen by accident. You probably noticed when we talked about the 5 elements of collective impact, equity is not a sixth element. It needs to be embedded across the five and be a part of every single action that a collective impact coalition or initiative takes. So some examples of how it needs to be considered and designed for is with the backbone organization, that you have to be really intentional about who are you hiring to represent your coalition? Where is the coalition housed? Like, who's the employing organization for the backbone staff? Is the person in the organization reflective of the community that you're trying to serve? And are those individuals and organizations committed to equity? Are they doing things to work on equity, diversity, inclusion at an organizational level and a personal level? The second level you can think about this is the member organizations who sit around the leadership tables. Are the organizations who are making decisions really inclusive of all of the groups that have been historically excluded? There's some tools I can share with Jen to share with you all that some of my colleagues have designed to really try to do an audit of, are the organizations who are at the table representative of the different demographics of the people we're trying to serve in terms of age, geography, race, et cetera, gender. Really important to just take note of that. Again, it's not going to happen by accident. It has to be really intentionally thought about and designed for. The wider collaborative ways that you're getting input and engagement on how you're doing the work. Are you getting voices and input from people who have been historically excluded and really empowering them, taking their feedback to heart and doing things differently based on what they've shared? And then lastly, the strategies that are implemented, the things that your collaborative actually does, are they designed for equity? Are you trying to achieve an outcome that's going to improve those disparities that we see in data? And are you involving people who are affected by the problem and making sure that they're at the table, at the implementation table, so that as things are maybe not going as planned, they can give input and feedback and help you adjust course because they have that lived experiences. So we'll tie this back to community engagement in a minute. I just wanted to pause. Jen, do we have any questions coming up in the chat yet?
I do not see any questions.
Okay, great. So as we're going through, please feel free to share any questions, because I'm going to talk about community engagement next, which is very related to equity. It's kind of how you achieve equity. So Jen, we can go to slide 11, which defines community engagement. So what do we mean by community engagement? This means that the individuals who are most impacted by a problem, so in the case of your work, individuals that have experienced ACEs, have a say in what the solutions are, have a say in what the challenges are with ACEs and how you can work on them, how you can prevent them, and how you can mitigate the impact or the outcomes that result from having ACEs. This means undoing a lot of paternalistic approaches that have been a part of the social sector for a long time, where assumptions are just made about what people need. I do a lot of work in substance use, and I see this all the time about a lot of behavioral health providers who are very good people, well-intentioned, making assumptions about what recovery looks like for someone. And many of you who probably work in recovery and substance use knows there's no one journey to recovery. It's very individual, and you'll only know what just the range of options and what's best for one individual by asking and engaging folks in the process. And so what community engagement is, this is really about sharing decision-making power with individuals with lived experiences. And it has to be ongoing. This is not just a one and done. This is not sending out one survey or hosting one town hall, but really as your work evolves, making sure that there's a way, a very explicit and well-communicated way for folks to share input. What it's not, it's kind of the opposite of that, but making sure that it's not just providing feedback, but truly engaging in the implementation as well, and not just a one and done kind of checking the box activity, but it needs to be authentic, and people will be able to kind of see through authentic community engagement versus less authentic community engagement. And for places that have seen a lot of consultants come in or a lot of coalitions come and go, they may come to the table with skepticism. And so it's our job to make sure that people feel heard and they can kind of see where their feedback goes. One really helpful practice is making sure that if you do get feedback, if you do engage folks, you play it back. and you say, you know, I took these notes and this is how I'm summarizing next steps of what I'm going to do with your feedback. Show them what's going to happen and make sure that there's an authentic ask to share if the way that you as the convener have captured that feedback, was it accurate? Did you actually reflect what people talked about, said, and shared? So then on the next slide, I wanted to just share, to be clear about what your goals for community engagement are. I think sometimes we can default to the one and done feedback survey or focus group because we're unclear about, you know, what's the goal for engaging the community and when. And so I'll share a few examples here of, you know, one goal can be sharing information very early in a process. Hey, we're starting this coalition. We're going to focus on XYZ topic. Our initial ideas are to work in these different areas. What do you think? And really go out and make sure that those with lived experience are able to weigh in very early on in a process and give feedback. The second piece about gaining insight into end users' perspectives is really aimed at getting at the root cause. So a lot of times we see the initial ideas of a coalition are still really at a high level of the areas you might want to work on. So you might, if you're working on an obesity coalition, for example, you might be working on increasing access to healthy foods or increasing the amount of time that people are getting physical activity in a community. And you might have some hypotheses about what stands in the way of individuals engaging in these healthy habits, but really making sure that you're getting at some of those root causes of what it is that stands in the way of eating healthy food or getting physical activity. And there may be a lot of things here that are at the root cause in terms of social norms, mindsets, behaviors that are really tricky to work on. But if you don't identify them and think about how they interact with other things in the system, it's going to be really hard to make progress on your goal. The third goal could be building awareness. And this could be amongst people in the community with the lived experience that you're trying to serve, as well as others. So I know this is a lot of the work for you all with ACEs, is not necessarily building awareness of people with ACEs, but engaging other members of the community, the practitioners, the folks in schools, the folks in the healthcare community, to know how to talk about ACEs and how to work on them. So there's the building awareness piece and thinking about community engagement of others in the community that are critical to the success of working on an issue. Building trust and buy-in is really important. So this is especially if you're thinking about place-based work, where you want to work with some community partners who work in a certain neighborhood to implement an idea. You need to make sure that those folks are trusting of your coalition and that they have trust with the end residents of that community. You can maintain transparency in the process by clearly communicating the process you're undertaking. And then lastly, this is really important to think about, how do you facilitate opportunities for leadership? This gets at that power sharing. If there's, you know, a typical decision-making table in your community of leaders of different organizations, how do you make sure that you create space for new leaders, the next generation of leaders, to step up and really own the implementation of this work? I just have two more theoretical slides here that I'll share, and then you'll be able to hear from some of your colleagues who have put these things into practice. So as I mentioned, community engagement and equity are not a sixth pillar of community of collective impact. It's really embedded throughout. So I wanted to just kind of put this into practice for you all. So with the common agenda, it's really important to have an overall goal and also a specific call out for the most disadvantaged groups. For example, you might say you're doubling the number of students in the district that are on track to graduate from high school, career and college ready by 2025. You could just stop there to say you're doubling the number. If you have a commitment to equity, you're also going to say, we want to eliminate the achievement gap for students of color, because you know right now, students of color have worse outcomes than white students. And so to have a commitment to equity means you're also looking at that number. With shared measurement, it's very tied to this, that you're not just measuring things overall, but you're disaggregating the data. So how are you disaggregating by zip code, by race, by gender, to understand the challenge, like where are the worst outcomes today, as well as how progress is being made in those different subgroups, to make sure that the most marginalized or disadvantaged groups are seeing improvements. The improvements aren't just making the advantage that some have even greater. With mutually reinforcing activities, this is where that concept of targeted universalism comes back. So it means that you're doing things that are designed specifically for the most disadvantaged that can also help the entire population, or making sure if you're doing something for the entire population, you design something specific for the most disadvantaged. So I'll give examples of both. So an example of targeted universalism is if you're designing something for someone with disabilities, for example, the ramps at the end of sidewalks are the most classic example of this. So, urban planners thought about how do we make ramps at the end of the sidewalk to make it easy for folks in wheelchairs to get around. That was very specific to folks with disabilities. And it really helped a lot of people. If you're walking with a cane, if you're pushing a stroller, if you're someone making a delivery to a corner store, it had broader implications and benefits for the entire population. The example of a broader strategy that can have something targeted for certain populations is here on the slide, that you can design strategies to improve math skills for all students and make sure that you have an ESL specific math tutoring program for students who have a language challenge that you want to make sure that's accommodated for, so that they have a chance of making the same gains as students who are native English speakers, for example. On the next slide, on continuous communication, things you can do there to engage the community well and work on equity is just removing jargon from your common agenda and make sure it's speaking in language that the community wouldn't use, not just kind of the inside language of people who work in the system. Communicating in multiple languages if you are going to do town halls, focus groups, surveys. And if you're engaging folks in person, having meetings at times that work for them. So I think it's one thing that the pandemic has helped, to have Zoom meetings at different times has really helped increase access and community engagement. Whereas before we saw a lot of meetings happening during the work hours, and that can be, it can be really excluding individuals who have other jobs that are not working on this problem that they want to provide input. And then lastly, with the backbone support, it's really important to think about, as I mentioned before, who is the backbone organization? How do they build relationships with folks in the community? Who do they have connections with? And they are representing the coalition. And so they have an outsized impact on how the community kind of sees the presence of addressing equity in the community or not. So I'm going to pause here and turn it over to some of your colleagues who are doing this work every day. As you have questions, feel free to ask them in the chat to me or to our guest speakers. So first, I want to invite Kylan from ACE Nashville to speak a little bit about how they have engaged the community in their process. Over to you.
Thank you, Melissa. Good morning, everybody. It is really great to be with you all to talk about something that is really central and important to the work of ACE Nashville, which is community engagement. Again, my name is Kylan Hadley. I'm the ACE Nashville coordinator. I have been with the collective for a little over a year now. And my office is at the Metro Public Health Department, but I am funded and work for the entire collective of ACE Nashville. So we have had a lot of really important lessons learned as we have developed as a collective over the past 6 years. Actually, in September, we're going to be turning 6 years old, which is very exciting. But one thing we knew from the get-go is that in order for this work to be lasting, in order to create an actual culture shift, which was our original goal, we knew that it needed to, from the get-go, be rooted in community engagement. So you see some photos here. This is actually from what we call our consensus workshops, or we use a facilitation method called TOPS facilitation, which stands for Technology of Participation. And this is an evidence-based facilitation method that really takes a complex question and then breaks it down and really kind of neutralizes some of those power dynamics in a room so that there is plenty of space for voices to be heard, and this kind of collaborative approach to answering a complex question. So this is from our original consensus workshop, which launched the work of ACE Nashville. We brought together 44 leaders in our city who were invested in preventing and mitigating ACEs. And we said, what does this look like if we do this together? So we had our specific question, which I will read to you. Our question that we asked that day was, what strategies can we use to implement a comprehensive public health initiative which will prevent childhood adversity, promote family resilience, and improve lifelong health? So rather than just send that out in an email or a survey monkey and say, give us your thoughts, which is Melissa mentioned is not a really effective way to do community engagement, just only requesting feedback. We wanted to bring everyone to the table, create this common agenda, and then build that shared ownership, which we hoped and succeeded in creating long-term investment and real change within our community. So this is, you see all these sticky notes, they all go up on the wall. There's lots that goes into this, hour and a half, 2-hour session, but it's basically a lot of conversation. And what you come out with is priority areas. So we came up with 4 priorities that became our work groups and then really built out our structure from there. So we started with those 44 original leaders who came together. And since then, over the last 6 years, we've moved to over 480 individual members, which represent 170 organizations and offices across Nashville. And I think we really believe that that success and community-wide buy-in started by engaging the community meaningfully very early on from the get-go. So if you could go to the next slide, please. So as we were getting rolling as a collective, our work groups were going well. Again, I'm going to go deeper into what our work groups are in a minute, but we realized we wanted to kind of cast a broader net and get everybody into the same room when we could. And so they started doing quarterly meetings. And these quarterly meetings we became a learning collaborative. We talked about relevant issues. We discussed, all things ACEs and practice related. And we really brought folks together in those learning initiatives. But also we wanted to bring people together to network, right? We wanted people to meet each other. We wanted people to understand who else is focused on this. Where else can we collaborate in the community? Because we knew that in order to create a culture shift, we couldn't hope that every one of these conversations was going to happen within the walls of an ACE Nashville meeting, right? We wanted these conversations to be happening in the workplaces, in other professional networking events. We wanted these conversations to ripple out, right? You throw the stone in the pond and those ripples keep going. So in 2020-21, we had a real opportunity to take a breath, ask, what are we going to do with our quarterly meeting time? We were all getting to the point where we were having a lot of Zoom meetings. People were really overbooked. We, for a moment, thought, should we take a break? And I think right at the very beginning of the pandemic, in that little fun no man's land that we can all recall from going to in-person to virtual, we did take a break on a quarterly meeting. And when we reconvened in July, we asked, okay, what does our community need? What are we going through together collectively? And how can we facilitate meaningful conversation and growth for our entire community? So you can kind of see this, look at these 4 quarterly meetings as a timeline of the pandemic, really. So in July, you will recall that what our nation was going through around racial justice and equity issues. And so we asked some experts in the field and in our community to come together and talk about, what does this mean in our specific local context, right? It's pretty easy to sit from your corner of the country and look out and read headlines, but we knew that there was work to be done in our community. And so we put together an incredible panel, and the event was called Healing Racial Trauma, Equity for North Nashville. And North Nashville is our historically Black community, and also has one of the highest incarceration rates. The zip code of North Nashville has one of the highest incarceration rates in the country. So we were asking ourselves, okay, what does our response look like? What does our engagement look like right here, super localized to the zip code? And of course, it wasn't only for North Nashville residents, it was for our entire community to really look at how can we support our Black and brown brothers and sisters during this time. And that event was very well received. Because of the nature of the content, we originally did not record the event, and unfortunately learned from our mistake, because we had so many people. I think at one point I counted emails around over 100 people asking for a recording of the event or reconvening, and we realized, all right, one and done wasn't it, right? So it was time to look at expanding, and we actually partnered with a local nonprofit who leads a lot of the collective impact work in Nashville, called the Center for Nonprofit Ministries. And we asked them to help amplify this work. And so they hosted a reconvening of our Healing Racial Trauma panel. And between the two events, we reached over 600 residents of Nashville who are really wanting to come to the table and engage in this conversation. And so we learned, okay, it matters when we ask, what's our community going through? You know, it matters when we really are open and receptive to the needs and the questions and the conversations that are happening, as opposed to, you know, planning out our quarterly meetings so far in advance and just kind of giving what we think we'll need. So we decided from that point on that every quarterly meeting we would really be attentive to, you know, speaking to our membership about what the membership was talking about already. So in January, there was a lot of conversation coming up. As you recall, we are through the COVID winter, but we are definitely not out of COVID. And we were asking ourselves, how are our kids doing? They've been in virtual school for, you know, what feels like a lifetime to them and to us at times. How are they surviving? Where can we support them at, and where can we build supports and systemic supports around them? And we also were really interested in incorporating lived experience into the collective's voice. So we started a project with the Mayor's Youth Council, and they have really done a great job of teaching us how to incorporate youth voice in a meaningful way. And this really goes back to those principles of meaningful community engagement that Melissa touched on. You know, it's about creating a space, learning to value youth voice and the voice of lived experience in the same way that we value professional experience. And so we asked the youth to come as experts and to teach us what's going on. And we had this incredible panel made up of a few members of the Mayor's Youth Council, and they came together and really kind of recap 2020 for us. You know, they're like, we understand, we were all kind of learning on the fly. This is what it looked like as a kid, right? And it was amazing, an incredible opportunity to hear from straight out of the mouths of our youth who had, you know, been through incredibly impactful election at that point that they were not able to vote in. And of course, we saw so much incredible change led by youth in terms of activism. And so since then, we've had a lot of people come in and say, you know, we are asking ourselves, our boards, our you know, staff, the way that we are incorporating interns, we're wondering, how do we get more youth voice at the table? Because this is a needed perspective. And so in April, we came together and said, all right, how are our children and families doing? We are, you know, looking at maybe coming back to school at that point for a couple of months and then summer break. And so we wanted to look at COVID as a collective trauma that it was, and how we could build support for children and families, mental health and relationships, and create environments where they could thrive. So our quarterly meetings have continued to be really impactful ways for us to gather with our community, respond to our community, and we are really committed to continuing to remain fluid and open to engaging and facilitating the conversations that are bubbling up all over our community. So if you go to the next slide. Oh, so I mentioned our 4 priorities out of that original consensus workshop. And the question was, what strategies can we use to implement a comprehensive public health approach? And so out of that, we got our 4 priority areas, which became our original work groups. And those were policy and advocacy, trauma-informed care, parent and community education, and continuous quality improvement. Each of these, I could do a whole session just talking about community engagement done in each of our work groups, but I will just say, since the pandemic started specifically, you know, it really has been about how do we get people together to facilitate these conversations and, you know, create really fruitful connections within the community. That's always been a goal, but each work group really pivoted beautifully during the pandemic to just become conveners, facilitators, and let the work group and the experts in the room really lead where we were going. We actually, since our original consensus workshop, and in fact, recently, we have created a brand new work group, which came out of our quarterly meetings. We had a group of pediatricians who were sitting at a table at one of our quarterly meetings, and they started talking to each other and said, we need some kind of coordinated response within the pediatric community. And so they created their own work group, and we just did a whole consensus workshop with them, again, to come up with new priorities, and we're just now relaunching that work. They formed right before the pandemic, and then for obvious reasons, pediatrics had to take a break. They were pretty busy. And we have recently reconvened and are relaunching this work. So it's just another example of why it is so important to get these folks around the same tables and to meet each other and start those ripple effects. So if you go to the next slide. So of course, parent and community education is one of our greatest assets. This work group does incredible work within our community. And in fact, recently they have added some parent members to the work group. This has been a goal for a long time, but it was out of one of our quarterly meetings that we met this incredible parent at our last quarterly meeting in April. She was one of our panelists to discuss the impact of the collective trauma of COVID-19 and what that looked like as a parent of a teenager. And so she has been an incredible leader and an incredible voice that is continuing to recenter our work around what true equitable community engagement looks like. And if you go one more slide. So now we're asking ourselves, who's left? Like who have we not gotten here? Who's missing? We've done kind of an audit, internal audit, looking at the sectors that we have represented within East Nashville. We've got, social services, education, government, higher education, and healthcare. These are all really well represented within East Nashville. But when we are talking about some of our more complex systems change initiatives, we realized that what we needed was the business sector. We needed to bring folks who are investing real dollars into our city and to talk to them about what it looks like to coordinate efforts to prevent and mitigate childhood adversity. So one example is that we are, one of our primary systems change and policy and advocacy goals is to increase access to high quality early childhood education. Nashville is a childcare desert, so we do not have nearly enough slots for the residents and the need. And so we knew that in order to create real change, we needed to ask the business community to join us. We needed to ask them to invest in this really essential resource for our city. And so we are moving in that direction right now. We asked recently the Middle Tennessee Donors Forum to connect us with individuals who might be allies to the cause. And we are really specifically targeting folks who might come and bring that support and then be able to have those conversations and spread that support within the business community. So we'll keep you updated on how that's going, but it's an ongoing priority. And that you can go ahead to the next slide.
Great, thank you so much for sharing your experience. Hopefully there's a lot of great lessons learned there that folks can take away and apply to their work. If anyone has questions for Kylan, please feel free to put them in the chat and we'll come back to her and Mark for questions after Mark speaks. So with that, I will hand it over to Mark to talk about the Strong ACC and how they've done community engagement.
Well, good morning, everybody. Thank you, Melissa. And I want to echo your comments about Kylan's presentation and the work that you're doing, Kylan. Just truly amazing and inspiring. And it's just refreshing to see all the work that you're doing and to hear the ways that you've gone about it. So thank you for sharing. And I want to take the opportunity also to thank you, Melissa and Jen, for putting together this series. It's been a great learning for me coming into this role as director of the Strong Accountable Care Community, and just 3 months ago, and being on a learning curve myself with collective impact. It's been a great education and so helpful. So thank you for putting this series together and for inviting us at the Strong ACC to contribute. It's a pleasure to do that. So I wanted to just lead off with a couple of mentions of some programming that we facilitated last week as part of the Juneteenth observance here in Northeast Tennessee. We have been putting on Strong Kids forums, as they're called, about 3 to 4 times a year, roughly every 3 or 4 months, addressing different topics related to children. And the session that we put together last week was around discussing race with youth. And we had a great participation and attendance at that event, and it generated a lot of discussion and engagement around that topic. And so we were pleased to be a part of putting that together and conjunction with other community partners. And then a couple of days later, we co-sponsored an event, a webinar that addressed ACEs, mental health in the Black community, and learned about a very amazing and inspirational project called the Confess Project, and it's misspelled here in the flyer. Unfortunately, it's the Confess Project, which is billed as America's first mental health barbershop movement. And the two speakers who addressed this, both from Johnson City, are barbers who have been trained by the Confess Project to create an environment within their barbershop that is open and affirming and welcoming of people, and creates an opportunity for clients to be able to talk about their issues and concerns. They view themselves as mental health advocates, not as therapists or counselors, but as advocates who have practiced active listening and are able to facilitate and engage in conversations that can ultimately lead to their clients being able to open up. And they talked about how just providing that opportunity for folks to open up, particularly young Black males who often are not able or willing to open up and feel safe in doing that. They can do that with the barber, and just that act of speaking out and openly verbalizing what they're feeling is empowering. And so they also talk about connecting clients to other resources in the community that may be necessary to help the client address certain needs. So that was very inspirational, and we're actually going to, we're following up this event with some additional meetings to further engage not just these two gentlemen, but also others who were in attendance who want to continue to address the unique needs of the Black community around ACEs and mental health. Next slide, please. So I've showed this this slide before, but it's worth showing again to give you a sense of the structure we have and how community engagement plays out. We have a leadership council, which is a group of 24 leaders, 12 from Northeast Tennessee, 12 from Southwest Virginia, who are the governing body for Strong now. And then we have these committees underneath the council that perform various functions in support of the council and help tee up strategies and recommendations and studies that the council may request or that they want to provide to the council. One of those committees is the Community Engagement Committee, which has existed from the very early days when Strong was getting started nearly 3 years ago as a way to strategize and build broad agreement around how to engage the community writ large in this work of improving health and well-being and quality of life across the 21 county, 2-state region served by Strong. And so because of that group's efforts, we have significantly engaged not only healthcare and social service providers, but also the business community and the education community, as well as the faith community in the work of Strong, which now includes more than 300 member organizations. But that work continues, and the Community Engagement Committee continues to meet on at least a quarterly basis to review how we're doing and to work on strategies and techniques to engage more groups within the strong ACC and to engage more diverse perspectives and backgrounds as well. It's no secret that Northeast Tennessee is overwhelmingly white, non-Hispanic, the most racially and ethnically diverse city in Northeast Tennessee. Johnson City is 91% white, non-Hispanic, 3% Hispanic, 3% Black and African American, 1.5% multiracial, and 1% Asian, which means that we have to work especially hard to make sure that we are engaging these racial and ethnic minorities in our work and giving them not just opportunities to attend meetings and to participate, but to have the opportunity to participate in decision making and helping to influence the direction of Strong. And that's a work in progress, to be honest. We have lots more work to do. As the new director of Strong ACC, I felt it was an opportune moment during Juneteenth last week to join forces with other organizations to allow us to engage and support and interact with the Black community particularly. And out of those meetings last week, I have formed some new relationships that didn't have before. And we're going to have follow-up meetings and opportunities to further build out and expand the ways in which minority communities and the Black community in particular can be engaged in the work of Strong. As I mentioned during the last meeting, we have 4 work groups that we have just launched that align with each of the 4 initiatives that we're undertaking this year that are part of the 17 initiatives that are part of our 4-year strategic plan. So each of these work groups, we have engaged and invited people to join, to contribute and participate in strategizing and overseeing and guiding these initiatives. And I have worked to make sure that those groups have as many diverse perspectives and backgrounds as possible. But there's more work to be done on each of those, and that's a work in progress. Next slide, please. So here are some of the strategies that we're using to reach out and engage our membership in the work of Strong. Some of these don't technically meet the definition of community engagement, as Melissa pointed out, but are nevertheless valuable and provide opportunities for people to have information and resources and knowledge that they may not have had without Strong. So I won't go through these individually. You can see them on the screen. We did when COVID struck, we did go to all virtual meetings, but are now beginning to open up and return to in-person opportunities and hybrid opportunities for meeting that I think will help reignite and help us re-engage with our community. One of the things that is exciting for us is that opportunity to meet in person through regional meetings. We've typically had all member meetings in one central location, but our geographic footprint is roughly 300 miles wide and 300 miles long. So it's quite a trek for some folks to get to Bristol or Johnson City or Abingdon for a meeting. So we've decided to use regional meetings to better reach the geographic scope of our community and give all organizations a chance to participate. Next slide, please. The last thing I'll point out is quickly becoming a major vehicle for community engagement, and that's our No Wrong Door initiative. We are implementing the Unite Us platform, technology platform here in Northeast Tennessee, which will be the first region in Tennessee to adopt Unite Us in order to achieve the No Wrong Door system, which simply says that no patient, no employee, no client should ever have to enter the wrong door if they're needing services or assistance for themselves or their family. And the only way to achieve that is through a robust community referral technology that allows referrals to be made and tracked and completed much more efficiently and effectively than ever before. And we believe that this will be a particularly helpful tool in reducing disparities in health and access to social services over time. We're presently launching this and building out the network, and it's a pretty massive undertaking to engage all manner of social service providing organizations to join the network so that the region's healthcare providers have ample opportunities to refer their clients or patients to these needed services. So we're working on that now, and it's so far been very attractive and compelling to the organizations that we introduced to it, and we believe it holds great promise for transforming the region's ability to connect health and social service providers. So it's a tool that is helping us engage our community and one of many, and we think it's one of the best tools in our toolkit right now. So with that, I'll stop and happy to answer questions later. Thank you, Melissa.
Thank you, Mark. Really great to hear about your experience, even the most recent work that you're just doing last week, as well as how it's fitting into the wider kind of strategies of the Strong ACC. So I really appreciate you sharing. I haven't seen any questions come in. So what I'm going to do is go to our break. We'll take about a 10-minute break. We'll come back at 35 minutes past whatever hour you're at. I know we have Okay. Welcome back, everyone. I'm not seeing any questions, so we're going to go straight into our breakouts. As a reminder, if you're in a place, maybe you're still commuting or you're moving to another meeting while listening to this webinar, if you cannot participate in the breakout, please just stay in the main room. Please join the breakout if you're able to unmute, turn on your video, and engage in a facilitated exercise. So that we know the people who are going into the breakouts are willing and able to participate to get the most out of this. So we're going to engage in something called a TRIZ facilitation technique. And this exercise can be really, really fun. It goes against kind of all of the visioning exercises you may have done in the past in focus groups or in meetings. It's adapted from a Russian engineering approach that encourages innovation and creative destruction. And what you do is you try to let go of certain things that you know, but it's sometimes scary to admit that are getting in the way of you all doing your great work. And that's, focusing on reducing or preventing ACEs in your communities. And it works really well in small groups, and it helps you. Sometimes I find with coalitions, when you're you have your vision, you have your areas you want to focus on, and you're really at that point where you're saying, what are the specific challenges we want to tackle? And when things seem like they're staying at too high of a level or too theoretical, using this exercise can be really helpful to identify very concrete, very specific things that need to be tackled. So if we go to the next slide, Jen. When and why and when to use TRIZ. When you already have some trust and you might be feeling stuck and people might not be saying what the unspeakable things are. When you really need to get more innovative, when you need to have some creative destruction and think outside the box. This is when you want to use TRIZ. If a group is earlier on, they don't have trust, you're still trying to get a lay of the land and set some boundaries to your work, TRIZ is not the exercise for you. But if you've been convening this group for a while, you have some boundaries set to your work, you know a bit about what's in and what's out, what you're doing, what you're not doing, and you really want to tackle some specifics, that's when you can use this exercise. So we're going to give you a chance to play with it a bit now. I'll walk you through what we'll do on the next slide. You're not meant to kind of come up with an answer or land anything. This is really to give you about 20 minutes to get into a small group and just try this out and see how it feels. So hopefully you can take this technique back to your different coalitions or your own individual organization and use it as a way to generate new ideas. So I'm going to walk you through the various steps here. You'll have some facilitators in your small group when you go in who will lead you through these steps. This will help prepare you. So step one, if you don't already have a sheet of scrap paper next to you or a blank Word document on your computer or phone, open one up now. What we want you to do individually is you will think about all the things you could do to achieve the most inequitable result imaginable with your collective impact project. So this is kind of the worst possible outcome. So you want to see, for example, ACEs to continue to rise, the percent of girls of color who have 4 or more ACEs increase, for example. And so you want to think about what's the most inequitable result? Who is the population who has the worst outcomes in your community right now? Write down all of the things that you could do to make things worse for that population, for example. So that's going to be step one. We'll send you into small groups and do that. And what we're going to do then do is go around the room and share those. So you want to go through the list after you have that list one by one and be really honest. And you'll say, is there anything that's currently happening in the community that either you're doing or you observe others doing that somewhat resembles the item? Okay, so you have to be really honest and kind of put a check mark or a circle, anything that has some degree of truth to it today. So that's step two. And then step three is to kind of create a list of the top few items that have some degree of truth to them today and start to brainstorm. What can help you stop doing this? What are the solutions? And so you'll see you have 7 minutes for the first step, 7 minutes for the second step, and 5 minutes to kind of generate solutions. This exercise is meant to take 45 minutes to an hour, so it will feel rushed, but we wanted to give you a flavor of what it feels like to go through this in this workshop setting. So with that, Jen, we'll send you off. We'll copy and paste these 3 steps into the chat so everyone can still be looking at them. I'll do that, Jen, while you get the groups ready. Welcome back, folks. We'll just give another 10 or 15 seconds to make sure that everyone rejoins the main room. We'll go into our last piece here. All right, Jen, if you don't mind going to the next slide. So I know we didn't get to complete kind of this activity or get to any solutions or answers, but would love just a few comments in the chat about reflections you had doing this. You know, what did you like? What did you not like? Did you have ideas of how you might apply this to your work? A takeaway that you had going through this exercise would be great just to hear from folks. I can read them as they come through on the chat. I'll share one reflection that bubbled up in our group as folks are hopefully sharing in the chat that, when we got to some of the solutions and shared how people are doing things differently to try to address these challenges, the couple of things that we got to, since we didn't have a ton of time, was that sometimes most of the time rather, the things that come out of these exercises are things that take some additional time and intention and thoughtfulness. They don't usually cost a lot of money, but you just have to work differently, which is really what's at the heart of collective impact, which is why it's so hard. Just to keep that in mind, that sometimes the interventions, the ideas that you all might have might not be very financially expensive, just in terms of your time and headspace to think about things differently. It can be a cost in that respect. And thank you for Marianne for sharing that. What she took away from this exercise was using creative solutions to think outside the box. So you can, I'll put in the chat as we wrap up here, there's a guide for how to do this exercise available online through a facilitation company or group called Liberating Structures. So I'll make sure I put that in the chat as we wrap up. And thank you, Sharon, for also sharing. I like this approach. It was a reflective exercise that can yield creative solutions. So it is one of my favorites. I hope you all have a chance to use it in the future if you're feeling stuck or want to generate new ideas. So our last section here is going to be on measurement and evaluation. So we can just go ahead a couple slides here to the next one, Jen. Thanks. So I just wanted to point out that to kind of open this section, that we've been talking about shared measurement as one of the 5 elements of collective impact, but that's just one piece in terms of measurement, data collection, evaluation when we think about collective impact. It's really very concrete and has boundaries. That shared measurement is the idea that you have a common set of indicators tracking towards your goal. So it's both defining kind of what I call the North Star. What's your ultimate metric you're looking at in terms of success? So I think I've shared this example with you all before about, I worked with a coalition that was looking to reduce poverty. And so we were going through an exercise to say, okay, when we're talking about poverty reduction, are we talking about literally moving families or individuals who are just at the poverty line over the poverty line? Are we talking about addressing living wage and working poor? So there's kind of your North Star, really defining that about what are you aiming for? What's the ultimate metric you're looking to improve? And then there's the disaggregating that into, okay, so we want to be tracking number of jobs that are created, perhaps. We want to be tracking use of different social benefits like SNAP, and making sure that you're measuring that in a somewhat consistent way across the community so you can learn together. So those measures are useful, and it's kind of looking at your ultimate success. But when I talk about collective impact evaluation, it's much broader than that. And so you can see that's the light blue circle here. It's really a range of activities that you use not only to kind of measure those community level pieces of information, but also to monitor your progress as a coalition about how you're doing. And the key to the evaluation piece is that you can do it earlier than shared measurement. Shared measurement is a piece that, since I primarily work with coalitions when they're earlier on, we don't get to shared measurement because you're really working to establish the common agenda and deploy strategies. And so shared measurement happens later. You may define your measures, but you're not getting to population level outcomes yet. So you don't have that data to see the changes necessarily. But with evaluation, you are looking at things that are earlier on, and you can be tracking from the first day that your coalition is meeting. And you're really thinking about how are you making sense of what's happening in the community, adjusting as you go. So there's really an element of learning here to make sure that as you're doing things, you're saying what's successful, where are we maybe failing or not making as much progress, and how do we adjust as we go. So that evaluation is really that learning piece, where shared measurement is going to be a bit more limited in terms of some of the measures to track performance and progress towards goals. So in the next slide, I just wanted to define a bit more about what shared measurement is or is not. So shared measurements can help, how are we making progress towards our goal? Are we creating more jobs? Are we getting folks into housing in that ultimate goal of reducing poverty? and really making sure that as you see those measures maybe changing over time, how do you make better decisions? It's really important that you're not just collecting data for collecting data's sake. You really want to be making sense of it. It's not meant to be punitive or foster competition amongst folks in the coalition. And it's not just a one and done, one-time report or really an evaluation. It's just really just looking at data and making sense of it together to influence what the work is of the coalition. So in terms of evaluating collective impact compared to a program or an organization, there's a few mindset shifts that you have to take on. So a lot of times when you're trying to evaluate a program, for example, you're trying to just isolate the impact of that one program. Did we improve people's lives as a result of this program? Whereas with collective impact, it's much broader than that, and saying, are we understanding how organizations working together differently is improving the overall system? So that's one. The second is moving from proving to improving. So a lot of times with a program evaluation, you're trying to say, did our program work? There's a lot of randomized control trials, for example, to try to have the kind of attribution of this program to getting to success. Whereas with collective impact, you're never going to get to exact attribution because you're working across the whole system. There's way too many factors at play to be able to isolate the impact of a collective impact initiative. And so you have to think more about improving, that you're collecting data and doing an evaluation so that you can get better and you can improve and make sure that you're moving towards those goals. And the last piece is that a lot of times when you have a program evaluation, it's very detached from everything else. Whereas with collective impact evaluation, it's very embedded, that you're constantly using, when we talk about the continuous communication, talking about evaluation and how things are going should be very embedded into those conversations. It's not that here's our conversation about our strategies and what we're doing, and here's our conversation about the evaluation. It should be integrated together. So how should you think about collective impact evaluation? Luckily, there's a guide that my colleagues where I used to work at FSG have written. I'll make sure I send you that link as well. I'll just write this down. And it's a really great guide that breaks down what are the different ways to think about evaluation based on the life stage of a coalition. So if we go to the next slide, that kind of where you are in the process is the primary way you want to think about evaluating where you're at versus where you might want to head. So what you see in this picture, and I'll walk you through in more detail each stage, kind of in the background, you have the social, political, economic context. So it's really important, as I'm sure you all know, to really understand and recognize and have a shared understanding of the context in which you're doing your work. And so really understanding what's the political landscape look right now, what is trust looking like, what are the broad demographics of our community as kind of the starting point for when you begin your strategies and be able to monitor that over time. Changes in policy, for instance, are really important to kind of track here. But what are the things that are very much outside of your control and bigger than your coalition's work, but will have an impact on your success? You want to make sure that's number one here that you're capturing. On the collective impact initiative itself, you want to be looking at the 5 elements of collective impact that we spoke about, knowing about, how are you doing building those? Those are the real building blocks. And how are you doing in terms of just overall capacity? How are you doing in terms of having people at the table, having people engaged? One of the questions I like to ask here is, asking the members that are part of the coalition, how optimistic are you that this coalition is going to do something amazing, change the outcomes in our community? Measuring kind of optimism is really important. Looking at your meeting attendance is another really good measure early on to know how engaged folks are. In the medium term, you start to see, this is really the squishiest area. This is when you start to see some of those systems changes. So you start to see behavioral changes about the professionals who make up a system. You start to see in your world of working on ACEs, you start seeing people asking what happened to you rather than what's wrong with you. So actually being able to track changes in behavior to make sure that you're working towards your ultimate reduction or prevention of ACEs, but are the people who make up the system changing their behavior alongside systems changes. So this might be tracking how much more money is flowing to ACE's work, how many more policies are being put in place, both policies with a big P across Tennessee, for example, and also organizational policies. So you could be tracking how many organizations are requiring a certain type of training on ACEs. That's an indicator of kind of the intermediate outcomes. And then ultimately you're talking about impact, level 4. So this would be your population level measure that you're really striving towards. So whether that's reducing the number of ACEs, preventing future ACEs, things like that, your ultimate goal. So I'll just give a bit more of a double click, if you will, on each of these. So I already talked about the context. You see here kind of the cheat sheet of things you might be looking at. So this can be collected primarily through secondary data, right? Things that are put out there on an annual basis where you can look at trends. And you may also then want to engage in interviews to kind of make sense of some of that information, especially if things are changing really quickly. Especially we saw a lot of this in COVID, right? So we're not going to wait until the end of the year when the typical data about youth mental health is collected. We're going to convene folks and ask them and collect data in that way. And then trend mapping is a specific tool you can use to actually take a step back and say, what types of things are increasing, what types of things are decreasing, and kind of look at that in a more visual way to be able to see what trends are, which direction trends are going and how might that impact your work. On the second level, we talked a bit about this already, but just again to reiterate it, this is the 5 elements and how you're doing kind of building the future capacity to implement, getting to stages 3 and 4. And as I said, you may want to be just asking your members different questions about optimism, attendance, engagement, as well as asking community perception surveys. How optimistic are you that this coalition is going to do things differently? And kind of doing a bit of a pulse check about how things are getting started and people's perceptions. On level 3, these are kind of the harder things to have existing data points for. So this is where you may want to be making choices about new surveys and tools and data collection methods that are important for the coalition's learning. And so there's going to be a real tension here that some of the stuff that I talked about earlier, you can get through conversations with your members or existing community health data, for example. But here, this is the stuff that, as I said, I call it the squishy stuff. It's the stuff that's hardest to work on because it's not currently measured. And so how do you have some tools out there, either surveys or interviews, through here it says specifically third-party evaluator, to have that neutrality of making sure that people don't feel like it's an assessment or punitive, as I said before, but really a third-party provider trying to say, you know, what progress are we making on changing behavior and norms in our community towards our ultimate goal. And then lastly, we have here the population level outcomes, which I don't think I have to go into great detail about. These may be things I always encourage coalitions that there's already kind of a data collection tool that's already capturing this information. So for example, when I worked at Childhood Obesity Initiative in Dallas, they already had a tool done through the schools that was measuring BMI. So if you have a way that a population level outcome is already being collected and disaggregated by different demographics, that's great. So you don't have to put money and time into collecting new data. Sometimes that's just not possible, and you'll have to figure out how do you collect this data in a way that's going to make sense for you all. So just a brief example here would Shape Up Somerville, which was another childhood obesity initiative here in Massachusetts. So the types of things they thought about these across these different levels, one in the context, it is important to think about readiness. So if you're launching something new, we talked about readiness for collective impact initiatives. And so this can be something in the context of, is trust increasing or decreasing, and why or why not for different stakeholders in the community. They were looking at the income and race ethnicity of the families that they were serving. And they also looked at family mobility as well. When they thought about the CI initiative, they looked at kind of the ecological systems approach of all the different factors, kind of those rings, if you think about a child at the center, and then all the different systems and settings that impact healthy eating and physical activity. They made sure that they had a good understanding of that model and use that to kind of design their strategies and look at how they were doing in terms of the implementation and the planning phase of things at step 2. The type in that squishy category, the things that they were able to really monitor and track in terms of changes to the system, were the changes to menu offerings in public schools and 40 local restaurants. So this included 2 levels. 1, kind of changing the menus to have more healthy options. And then 2, finding a way to communicate to children and their families which of the options were the healthy options, highlighting them, putting an icon next to them. So saying how many did we target, what kind of change did we get? They tracked the increased funding for this type of work. So knowing, are we actually attracting more funding because we're working together differently? They looked at the changes to the built environment of bicycle lanes and parks to say, okay, we're making progress there to create more opportunity for people to exercise. And lastly, they tracked the progress that they were making to improve nutrition standards in places like schools and other public facilities that have an outsized impact on certain populations. And so the ultimate outcomes that they were able to measure is that overweight students that participated gained about a pound less than children in other communities. And participating students who were overweight in 2010 gained about a pound less if they had stayed on their weight gain trajectory. And so this was through an existing kind of measurement system within the Somerville schools that were collecting this data year over year. So that's what I had to share on measurement and evaluation. We don't have time to kind of do small groups. So would love to hear from folks if you have just something you learned today, a reflection about measurement and evaluation in the chat. I'm going to put myself on mute and find those few resources for you all while you share. Oh, sorry, so you can have access to those in the chat before we wrap up. So go ahead and just share any reflections that you had from today or outstanding questions.
Melissa, this is Richard Taylor. I appreciated this last section on the data collection and data sharing because that's what we do day in and day out. And you did a great job in covering the different types of data and the different types of evaluations that need to be considered at both the population level and at the individual level and at the aggregate level. And so I appreciated your taking the time to go into the details on the data part of collective impact, because that is certainly one of the most important things that you can do to measure success. And it's not just on the population outcomes, but also on the process itself. How are we doing as a team in terms of working together collectively to make decisions? So thank you.
Great, so happy to hear that it was helpful. And if you have any additional questions or feedback, feel free to get in touch. I just put the TRIZ exercise instructions in the chat, as well as FSG's guide to evaluating collective impact, which has just a rich array of guidance and examples. And I will also put my email in case you have any additional follow-up questions once you leave today's section. Yeah, great question from Melissa Roberts about, is there a specific software that you've used that helps to measure? So I have not. That's why I specifically didn't highlight it. I do have a list that I can dig up. A lot of folks that I know have used kind of more project management software like Bootcamp to help bring people together and communicate and do the shared measurement piece. But I believe there's a few others out there of providers. So I can dig those up and send those to Jen to share in the follow-up email. Great, and put my email in the chat. If you have any follow-up questions or you need help finding certain resources, don't hesitate to reach out. I'm happy to connect you with either other individuals or reports and resources as needed. With that, Jen, I don't see any other questions coming in or reflections. Do you want to wrap us up?
Absolutely. Melissa, I cannot thank you enough for doing this series for us. I have gotten so many compliments in Zoom meetings, as well as through email and text over the last 4 sessions. And I think this is just going to be incredibly valuable as we think about moving back to in-person life and responding effectively to the additional trauma that COVID-19 has led to, in our state. So anyway, with that, thank you guys again. I will be sending out, like I said in the chat, the recording. It usually takes me about a day because I have to edit it. So by close of business tomorrow, you'll have the recording. You will have the resources that Melissa mentioned, and you will have a PDF version of the slides for your review. So everybody have a great rest of your day. Thanks again for taking your time to join us.
Thank you, everyone.